I gave my abusive surgeon boss exactly what he deserved when he became my patient, and 5 years later I still sleep like a baby knowing what I did. As an HUU nurse for over a decade, I've dealt with countless difficult doctors, but Dr. Maxwell was legendary not for his surgical skills, though they were impressive, but for his complete disbelief in post-surgical pain management. Pain is psychological, he'd announced during rounds. We're creating a generation of addicts by overusing narcotics. Easy to say when you are not the one with a fresh 12-inch incision across your abdomen. Dr. Maxwell's patients suffered unnecessarily. He'd order Frananol for patients who were literally shaking in agony after major surgeries. When we nurses called for proper pain medication, he'd lecture us about enabling drug-seeking behavior in medical coddling. The worst part, he made hospital policy. As chief of surgery, he implemented a conservative pain management protocol that required nurses to try non-medication interventions for 45 minutes before calling for prescription pain relief, repositioning deep breathing exercises, all while patients suffered. We complained to administration, patients filed complaints, nothing changed. Dr. Maxwell was untouchable parent. He brought in too much money and prestige to the hospital. Then came the day everything changed. I walked into my 7 a.m. shift briefing to find my colleagues huddled around the assignment board, whispering and pointing. There on the patient list for our surgical ACU was a name that made my heart skip. Maxwell, Rhode Island Shard. Dr. Maxwell had been in a serious cycling accident the previous evening. He'd undergone emergency surgery for multiple traumatic injuries, including a complex pelvic fracture that required extensive reconstruction. Who's taking him? Our charge nurse asked, looking around the room. Nobody volunteered. I'll do it, I said, surprising even myself. My colleagues stared at me with a mixture of horror and admiration. When I entered his room for morning assessment, Dr. Maxwell was already awake, pale and sweating. The moment he recognized me, I saw something I'd never seen in his eyes before. Good morning, Dr. Maxwell, I said, checking his vitals. How would you rate your pain on a scale of 0 to 10? 9, he whispered hoarsely. Maybe 10. I need something stronger than what they gave me overnight. I nodded professionally while checking his chart. I see you are on the conservative pain management protocol. Your protocol actually, his eyes widened. Listen, this is different. My pelvis is literally held together with hardware right now. I understand, doctor, and according to your protocol, I'll first need to try repositioning, ice packs, and guided breathing exercises. If those don't work, I can offer you Flurinol. This is ridiculous, he hissed through clenched teeth. Call Dr. Peterson and tell him I need delighted. Now, I arranged his pillows methodically. Dr. Peterson actually left orders to follow standard post-op protocols, your protocols. For the next 45 minutes, I did everything by the book, perned his book. I applied ice packs. I helped him change positions, which caused him to cry out in pain. I guided him through breathing exercises while he cursed at me. When the timer on my watch finally beeped, I said, now I can call for medication orders, though I should remind you what you always tell us, parent pain is largely psychological. The look he gave me could have frozen hell. 3 days later, Dr. Maxwell was transferred to the regular surgical floor before he left ITU. He asked to speak with me privately. I expected anger instead, he said. I've been a terrible doctor, haven't I? I didn't answer directly. Pain is very real, Dr. Maxwell, and very personal. 2 weeks after his discharge, the hospital announced a revised pain management protocol. Training sessions emphasized the importance of believing patients' pain reports. Dr. Maxwell himself led a staff education session on the neurophysiology of pain and the dangers of undertreatment. Was what I did petty? But sometimes the only way to create change is to make sure those in power feel what their policies actually do to others. Sometimes the most effective teaching tool isn't compassion. It's a taste of your own medicine.